The next speaker, I'd like to introduce Professor Kaori Muto. Kaori Muto is Professor of the Department of Public Policy, Human Genome Center in the University of Tokyo. She has been working in the field of biomedical ethics and medical sociology. Her her research interests include ethical, legal, and social implication and patient and public involvement. She has also served as a member of expert meeting for COVID-19 in the government of Japan. So let us now welcome Professor Kaori Muto.
Hi, thank you very much for inviting me to APSA 2020 webinar, and I would like to thank you, Zakia, Miyako, Emma, and Nina, and other colleagues. Thank you so much. And I am a medical sociologist working in Tokyo, and I would like to talk about mainly the roles of experts in the COVID-19 pandemic. Let me begin by sharing the latest numbers of COVID-19 in Japan. Japan has a population about 126 million. And as of October 5th, the total number of active cases was 85,000. And the 1,597 deaths has been reported. And there were almost 80,000 recovered cases. And the figure on the left indicates reported active cases. And between April 7th and May 21st, the Japanese government declared the state of emergency. And now we are standing at the point of so-called the end of second wave of this summer, or at the beginning of the third wave for this winter. And the figure on the right shows the total death by logarithmic scale. And you can see the trend line was very steep this spring, but recently it seems to be relatively stable. As a country, Japan did not experience SARS or MERS, so we did not learn from those experiences. However, in spite of our devastatingly poor capacity for testing people each day at a rate only 1/5 of the South Korea last spring, the total number of deaths didn't rise. This figure shows our organization chart for the government COVID-19 response during the first 6 months of the pandemic. And I'd like to show two laws. These two laws played important roles. The first is the Special Measures Act. And under the Article 31 of this act, the government declared a 1-month-long state of emergency related to COVID-19 outbreak. The area was limited to 7 prefectures, and the government finally expanded to all areas in Japan. The measures such as restricting the use of large facilities to prevent people from gathering became possible under the terms of the law in response to this pandemic. However, this act does not have power to enforce people to obey countermeasures. So we can just ask them or request them to cooperate. And another act is the Act on the Prevention of Infectious Disease. And this law classifies infectious diseases into 8 categories based on their levels of contagiousness, seriousness of the symptoms, and types of disease. In the case of new disease, officials may recommend that a person who is suspected of being infected receive a medical examination and mandatory hospitalization. And I was assigned to attend the expert meeting for COVID-19 to give advice from a medical expert's perspective on COVID-19 countermeasures. And this expert meeting was an ad hoc advisory committee answerable to the government. And it was established to provide advice and suggestions. And I am a sociologist, so that I cannot give any medical advice, but try to advise on ethical, social implications and risk communication. And we have held discussions almost 24/7 since February 14th and have recommended to the government. And these are the 3 pillars of COVID-19 response strategy in Japan. And a significant COVID-19 cluster is declared when there are 10 or more connected through transmission from a single site among people who are not all a part of the same household. And clusters include both confirmed and probable cases. And with strong support from public health centers, we could trace them retrospectively and recommend them to close contact to isolate. And we also published several situation reports. On February 24th, the first perspectives report characterizes that the high-risk environment on COVID-19. And we had to have these 3 pillars approach only because the capacity for testing and intensive care units were devastatingly poor in the early phases of the pandemic. And we had to ask the public to prepare for standard precautions to support hospitals and to save hospital professionals and save the elderly people and also people with pre-existing conditions who are most vulnerable to COVID-19. And fortunately, people were very cooperative in Japan. And according to our survey, the most important event influencing these precautionary actions was the infection aboard the Diamond Princess cruise ship, which occurred in early February 2020. And in addition to standard precautions, the 3 C's concept for raising awareness of high-risk environment has been widely used in COVID-19 prevention campaign, and not only in Japan, but also by WHO. And to date, the expert meeting has published 3 perspectives papers and 12 situation reports and recommendations. And every time after we had official meeting, we revised the draft in a few hours and held a press conference that lasted more than 2 hours. And the public was informed and updated on the situation in a timely manner. And on July 3rd, the cabinet disbanded expert meeting and established a new subcommittee. And this is a current organization chart. And now I am working on the prejudice, discrimination, and privacy and protection. And I think many people are really afraid of these about broader societal issues. And I like to suggest 3 things. First of all, there are so many defamation and discrimination against some groups, both online and offline. And healthcare professionals and care workers are very, very much very criticized due to nosocomial infections. And I think also employees at the club, which provides male companions to female patrons, are also criticized in Japan and stigmatized due to their virus was origin of the 2nd wave. And I'm very cautious about the next targets in this winter. And second, building trust and cooperation for COVID-19 responses for people working at the places of the higher risk is quite important in Japan right now. And thirdly, prolonged prohibition of visits to hospital and social care institution. We asked them to do this, but however, efforts to prioritize the long-term prevention of COVID-19 have put various pressures on the quality of life of other vulnerable populations. And I'm very afraid of the breach of the privacy. And these are the from the newspapers, and newspaper reporters wrote the cluster map or correlation diagram reported. And they these are really, I think it's really dangerous and a breach of privacy. And I asked them to not to do this again. And fourth, we have observed disparities in long-term risk perception. And some people are really afraid of COVID-19 and act very carefully. And their actions are sometimes offensive to others. And also, in addition to these things, stay-in-place orders, school closures, and curfews are very burdensome to women. So we want to collaborate together, and we want to challenge the new good society in Pacific and Asia area. So thank you very much. These are my colleagues. Thank you so much.
Thank you very much, Prof. Kaori. Now, I invite back Professor Miwako to introduce our next speaker.
Thank you very much, Professor Kaori Muto. I'm really sorry you have very short time for it, but it was very excellent and informative.